This is ultrasound study of the second trimester pregnancy. Referred to me to rule out any anomaly relating to the fetus, uterus, and or adnexal, because of the pain, constant dull pain she feels in the region of the right lower abdominal quadrant that radiates to the pelvis. Now here we are seeing the head of the fetus, and you did saw the movements and the biparietal diameter from outer to inner is suggestive of a 15 weeks pregnancy plus minus 2 days. This is the placenta, which is grade 2. And you can very well see the movements of the head of the fetus within the amniotic fluid. So the movements are fine. And this is the placenta. This is the placenta grade 2, fundal, anterior, posterior, head of the fetus, and here we come towards the body of the fetus. It is a cephalic presentation, that is cephalic. This is the spine, neck and spine together. This is the fetal neck region, this is the head, this is the spine, this is the fetal body. Okay, still concentrating on the spine. No outgrowth seen from the cephalic to the caudal end, so the spine is okay. This is the femur. You can see the two femurs, and just measures 19.4 millimeters or 1.94 centimeters, that corresponds to the gestational age of 15 weeks, 5 days. This is the transverse of the fetal abdomen. This is the transverse of the fetal abdomen. This is the vertebra. This is the umbilical vein. This abdominal circumference measures 94.9 millimeters, corresponding to the gestational age of 15 weeks, 1 day. So all these measurements are within the same range, and the fetal weight is 128 grams, and EDD is 27 February 2013. Here what you see is the choroid plexus. This is the head of the cranium. This is the cranium. This is the fox. This thin line, thread-like line, is the fox cerebri, and these two echogenic areas within are the choroid plexuses. The amniotic fluid is adequate for the age of the gestation. This is the fetal head, and we do not see any anomaly relating to the fetal head. Then here we see the heart, the cardiac activity. You can see the flicker, and the cardiac activity is 144 to 145 beats per minute with regular waveform. The waveform is regular. This is a magnified view. Here we can see the stomach bubble. This is the stomach bubble. And can we see the kidneys at this very early stage of gestation? The urinary bladder, the kidneys. It is difficult to see, but now this is the kidney. This is the kidney. One kidney. Okay. So far, where is the umbilical cord? Okay, let's see that also. Let's go to the normal view, and now fetal movements are good. This is the umbilical cord. This is the umbilical cord, this is it, and it is normal, 2 arteries, 1 vein. This is the umbilical vein cord. This is the fetal head to magnify, to show you face, and if we wait for some time, we will come across these are the fetal limbs that are moving, and you are seeing them. This is the end of the fetus. Yeah, this area. This is the forearm and this is the hand of the fetus. Here are the two eyes. This is the eye, this is the eye, and the distance is 1.8 centimeters. It is within normal. So far the studies are remarkable for any pathology related to the fetus. The movements of both hands. This is again the hard transfer section of the abdomen and the thorax. Now, let's see the cervix. This is the cervix. And the internal os is closed. This is the cervix. It measures 4.6 centimeters in length. This is the cervical canal. This is the internal os. And see, this is the placental tissue which is away from the os, the posterior segment. Here is the internal os. And it's quite far away, 5.2 centimeters away from the cervix or the internal os. So the placenta is posterior wall as well. However, it's quite far away from the cervix. Now there is a cystic area seen posterior to the uterus and posterior to the uterus and the cervix of the female. This is the cystic area that may. Now this is the cervix, this is the urinary bladder, this is the cervix, and this is the cystic area that we have seen and measures approximately 5 by 5 centimeters, rather 5 by 6 centimeters. So this is the cyst. This is the urinary bladder in longitudinal section. This is the cervix in longitudinal section, and this is the amniotic fluid. Let's concentrate on the cyst. One thing is for sure, this is a cyst that extends from posterior to the cervix of the uterus into the region of the, I'm going upwards into the right adnexa, and it has multiple septa within it. Let's concentrate only on this cyst. Now it's a multi-septated cyst. This is it. Now its dimensions will be different, because I have concentrated only on the cyst. This is the cyst. This is the urinary bladder in longitudinal section. This is the uterus. This is the anterior myometrium, and this is the cervical. This is the cervix in longitudinal section, and these thin lines that you are seeing, thread-like areas within this is are the septa. There are low-level echoes in the dependent region of the cyst. These areas represent the low-level echoes within the cyst. It is not relating to the gestational sac. It's outside the uterus, and it is thin wall extending from posterior to the uterus into the region of the right adnexa. This is a complicated right ovarian cyst. And you see that here, these are the dependent region echoes within it. Rest all of these are septa. So this is a multi-septated cyst with the dependent region, internal echoes, thin wall, with you see why it is a cyst. You see posterior wall acoustic enhancement, brightness posterior to the posterior wall of the cyst. So this is the cyst. Now this is the cervix in transverse section, the area I'm going to show you now, this one. This is the cervix in transverse section, this is the cervical canal, and this is the cystic area, this is the urinary bladder. So this is a 15 weeks pregnancy with